Hi, it's Dr. Christy Ennis. If you have stretched and massaged this hip till the cows come home and you are still having pain, you might actually have weakness in those hip flexor muscles and not just or instead of tightness. So today we're going to go over how to test yourself and then the exercises you need to do to strengthen it up. Okay, first test, you need a chair to sit on. And this is, if you have weakness here, you don't even need to do any of the other tests. If you don't though, you're gonna progress into the other tests, which are a little bit more difficult. So if I'm testing out my left leg, I'm gonna raise that up above 90 degrees. And I'm taking my opposite, whichever hand, jazz hands, and I'm gonna press with my hands down and I'm gonna try to resist that with my hip. Now you wanna try to push as hard as you possibly can. Don't cheat yourself here. If your hip just wants to drop on down, then you know you have some weakness. Alternatively, if you have someone who can help you out, it is a little easier if someone else is pressing down, but you can still do this all on your own. Our second test, which is a little harder, is going to be standing. So before you do this one, you actually want to think about tightening up those stomach muscles. That helps to prevent tilting of that pelvis and actually just working in through those hip flexor muscles. So you want to think about that for the exercises that we do too. Okay, I'm bracing, brace that core. I'm gonna lift that leg up. This is also balancy, right? And you're gonna do that same thing. Either take a partner or your own hands, press that hip up, press those hands down, try not to let it move, also try not to fall over. And then you do want to test both sides. Our last test requires you to get on the ground and you're gonna sit with your back nice and upright against something relatively sturdy. Engage in that core. And from here, if I'm testing that left leg, I'm gonna lift it up. Now notice I'm not lifting it really high or I'll lose this position. You wanna be able to hold this for about 15 seconds. So if you can, whoops, if you can do the other two, but you get to this one and you're like, oh, can't hold that thing up there, then you do, as I'm shaking, then you do also have some weakness. Now also keep in mind that you can still have tightness, and I will link a video for you on that as well so that you can test that out. And again, ready? Mind-blowing thing, you can have tightness and weakness. You wanna work on the tightness first and then check to see if you are still weak. And if you are, then you're gonna follow me along with the next exercises. Our first exercise requires you to lie down. Yay! You can either do this on the floor or on the bed. You're gonna straighten one leg out, and of course you're gonna engage in that core. Remember what I said in the beginning there. And then you're gonna think about lifting this leg straight up. Now I'm not, again, not lifting really high. If I do, it kind of negates it. So here and then down, and then to get all angles, all parts of those muscles, you're gonna turn that foot out and do that same thing. You've got a little inner thigh work too. And then you're gonna turn, turn those toes in and do that as well. So you wanna try to shoot for 3 in each position. All right, this next one, standing, is a little bit harder. You can hold on for balance, but you're gonna take and you're gonna lift that knee up. Of course, the core is engaged. And goal here is a little bit of an isometric. You're just gonna try to hold it here, okay? So you can breathe, you can sing a song, you can pat your head and rub your belly. Start for, or at least aim for, 30 seconds. To make this one a little bit harder, you can place an ankle weight around, well, the ankle. You can even use a kettlebell around the forefoot, but I find that uncomfortable and actually pretty difficult. Or you can even take a loop band and put it around your forefoot, and then you're adding a march. And actually, if you can, you wanna think about really driving that knee up. It's almost like I'm running straight up, right? That actually adds a little bit more force to it as well. Okay, we are back on the ground again. It's part of the exercise, just getting up and down. So from here, similar to the test that we did, we're actually gonna lift, clearly my muscles are working hard. We are going to just lift that leg up and down. You wanna shoot for about 15. If that leg really starts to get tired and shaky and that knee starts to bend, it doesn't matter if it's been 15, you stop wherever that is so that you make sure that you still have good form. To make that one a little bit harder, you're gonna take an object, and because I love coffee, I'm gonna use my coffee cup. Yes, this energy partly is from caffeine, but you're gonna place that coffee cup or even a smaller object down on the ground. You're gonna think about starting that movement again with that lift. This time you're gonna lift, over. Tricky. You can actually do a couple different objects too, if you wanna make it a little bit harder so that you're going in a line. Same idea, you're going until it starts to get a little bit difficult to do, and that's usually a little less than the other one, so somewhere between 10 and 15. For our last one, you either need a chair, or if you happen to have a bench like this, you can use that because our legs are going up on this. This one is the most difficult one. We're actually going to start out in a bridge. So get a little pelvic tuck if that feels okay for your body. You're going to lift those hips up. And then you're going to take one leg and you're going to bring it in towards you and straighten it back out. Now this one I love because not only is it working our hip flexors, but now we're actually using our glutes and hamstrings on the other side, which if those are weak, that's going to make hip flexors tight too. So you can do one side at a time and then obviously switch to the other side. To make this one a little bit more difficult, you can add a band right around the feet.